like I said,
But
there's been no balance this year with the refs and the way they call these penalties. It's just nuts,
hey,
man.
man, the only thing I can say is at least I'm not a Cowboys fan.
Oh God. Or an Eagles fan at that.
Yeah, but
Carol,
the
I hope you're
Cowboys
not.
got
Carol, if you're a football fan, I hope you're not a Cowboys or an Eagles fan.
the Eagles had a shot. They had a couple of shots to get things moving. The Cowboys, I don't know what happened to them. They self-destructed in a way that I have not seen before. It's
For
kind of
me,
impressive.
it's more of she's
Go
for
Niners.
that's the only NFC team left now, right? The
No,
Niners.
well, they're the only NFC West team.
West team, that's right. Oh man. You know
Yeah,
what?
so
It could be the Niners year. They do look good. I will say that. But it's man, I like this year's playoffs. It's pretty
it's
I'd say it's
close.
pretty unpredictable and very close in terms of competitiveness. You just don't
That's
know
why
where
I
it's going to
honestly
go.
thought if Dak or Lamar don't get it this year, they ain't never gonna get it because it's so close. It's anybody's game right now.
Well,
But
what's funny, and I'll leave it at this before we get started. But I was looking at I'm a Jags fan, obviously. Trevor Lawrence has one playoff visit, and so does Lamar Jackson. It's which is just wild to me. You know, they just
oh man,
yeah.
Sunshine. You're gonna have to do something about Sunshine. I don't know. I think the Jags might need to move on from him, but that's just me.
Yeah,
We'll see how it
I
goes.
give them one more season, and then we'll see what happens. That's kind of where I'm at.
Sounds
But
good.
hey, anyways, guys, thanks for joining in. Sorry if you were listening to our NFL rants. It's obviously playoffs right now, and well, let's just say, needless to say, both our teams are now out. So, well, my
They're
Jaguars
all on
have been
vacation.
out. So, but anyways, I appreciate everybody joining in. From Leanne Matthews, sound is off. Carol, can you hear us? Is anybody having issues with sound? Leanne, are you connected through? Okay, Carol can hear us. Leanne, can you hear? Or I'm sorry, check your. I don't know if you're on a computer or possibly a cell phone. Okay, good. It looks like Leanne fixed that. Great, great, great. All right, Jose. Well, let's get started.
Yeah,
Again,
let's
everybody,
punch in the face.
appreciate you guys joining in for another episode of our compliance step-by-step webinars. Again, let's go ahead and dive in, get the brain juices flowing. For those of you that were on last week's webinar, we did talk about navigating contractor relationships and business associate agreements, all that good stuff. So I want to start off with a quick uh, trivia question just to see where everybody's heads are at before we get started on today's subject. So I'm going to go ahead and share screen. Let me know if you can see it, Jose.
Oh, still looking at you.
Might. How about now?
There we go.
Awesome. So today's trivia question. According to HIPAA rules, what is the definition of a business associate? Is it
Okay,
A,
all right.
an individual organization that provides healthcare services directly to patients? B, an entity that creates, receives, maintains, stores, or transmits patient health information on behalf of a covered entity or business associate. C, a person with expertise in mental health telehealth clinics. Or D, an instructor at epi conferences events. Guys, I'll give you 30 seconds to put in your answers. So far, we got a few in. Susan, Leanne, thank you for your answer. We'll give it about another 20 seconds. I know I made this one very complicated.
Well, it's funny that you say that because
Oh,
technically,
here we go with Jose's technically. So, guys, appreciate your answer submission. The answer is, in fact, B. A
the answer
business.
he's looking for, the answer you're looking
The
for
answer
is
that
B.
I'm looking for is B. And then we'll listen to Jose's technicality here.
It
But
could be D.
it could be D. You're right. It could
Because you
be
could have
me.
a bit as someone who operates as a business associate, but also an instructor at an FP conference event. But anyway,
There
so
you go. That's funny.
but
All right.
let's punch it.
Yeah, what's punching it in the mouth. Guys, appreciate you participating in that. Looks like everybody's heads are here. Let me get out of this and then we'll dive into the presentation just a moment. Ba, ba, ba. Let me know if you can see Jose. I'm going to share one more time.
It's coming up now. There we go.
Perfect. So everyone, again, thanks for joining in on today's compliance step-by-step webinar. My name is Ray Walters. I'm going to be your host for today's webinar, and I'm thrilled to have my guest yet again, Mr. Jose Delgado, who has over 17 years of experience in business development, healthcare management, and consulting. As always, his latest venture is owning a mental health clinic, a telehealth clinic at that. And today, Jose and I are going to be expounding on HIPAA privacy and security, in particular, navigating consent for patient health information. So without further ado, just a little bit of background about EPI compliance. I think Jose stole my thunder last week. We kind of just dove straight into it. I didn't get a chance to let our audience know about what we
My
do.
fault. My fault.
Oh, it's okay. I forgive you. But before we dive into the subject matter, just want to give you guys a brief background of EPI compliance. We were established in 2013 by leading healthcare professionals. We have developed exceptional compliance training and healthcare protocols for healthcare organizations, healthcare students, business associates, etc. Wanted to mention as well, we started a conference called EPI Conferences, where we teach a certified HIPAA security officer training. I actually think we have a couple people on here that have taken this course in person. And yes, right
Yeah.
now this is a in-person course. I saw Susan Romanelli in here, Jose. But
Yeah, I saw that
Jose
too.
Delgado is a instructor for this particular program. This is a program that we're going to be offering online here very soon. I mention this every presentation. We're looking to have this up and going by the end of the first quarter of this year. So stay tuned for that. We'll certainly be sending everybody information. But Jose, did you want to add anything in terms of the CHSO
Um,
course?
in regards to the CHSO, the one of the main benefits for doing it in person is that the normally the presenter, myself or someone from my team, we like to input color commentary along with the actual education. So we'll use current cases that are working their way through their courts or working their way through the media and go over live examples of situations like this. So that way you can always have that callback because it's better than just death by PowerPoint, you know?
No, absolutely. And Leanne, appreciate you. Carol, appreciate you being there as well. And like I said, this is going to be soon a course that we will be offering online. Obviously, Jose, who would you recommend this training to?
Anybody that you're looking to groom as the security officer. So let's say right now you're an administrator, obviously take it for yourself, but then use the course in two ways. One, to get your own certification, but two, to kind of figure out the kind of person in your team that could benefit from taking it and that you can delegate some of the responsibilities for this off on. And we can definitely help you out identifying the kind of personality traits that you would want in a compliance officer.
Absolutely. No, Jose, appreciate that. And as mentioned, stay tuned, everybody. This is going to be a course that we will be offering online so that if you're out of state and you're not in Florida, it'll save you some, it'll save you some money and you'll be able to take it online. So without further ado, I'm just going to dive into real quick, just what we're going to be discussing today in terms of objectives. We're going to give a little bit of overview on what protected health information is considered. We want to expound on the importance of maintaining confidentiality in healthcare. We want to discuss the importance behind consent in healthcare. And then we also want to explain permitted uses and disclosure of protected health information. So Jose,
Yeah,
let's
let's
take it
punch
away.
it. So
So
Yeah. So when we're talking about personal health information individually identifiable health information, we're talking about any combination of basically two pieces of information that'll helps anyone identify who that is. That's your social, your first name and your last name, or your date of birth, your address, your personal phone number, so different things like that. In any little piece of that, just the first name or just the last name may not really matter. For example, my last name Delgado, not very popular here in Northeast Florida. You go to Orlando, Puerto Rico, there's a Delgado on every corner. So it's one of those
Orlando.
things where it kind of just helps. And you want to make sure that you understand what it is that you're trying to protect so that way you can protect it properly. Lately, now, when it comes to PHI, even if you're on the vanity side of medicine, you're looking at it as PCI compliance, but it's the same crap. You're trying to protect bank account information, which you should be doing with healthcare anyways. Social security information, again, we just went over that. Date of birth,
Mhm.
full name, address. So it's all the same stuff. It's just PCI decided to call it something else just because not everybody's in healthcare. So that's basically what I would detail it as. And obviously diagnoses with names, that can be a whole nother problem, but I'm sure we'll go into that here shortly.
Jose,
So
this obviously might be a common sense thing, but the importance behind protecting patient privacy, right?
I mean, yeah, outside of the carrot and the stick method of keeping your job and staying out of jail, there's also the civil penalties. There's also just the ethical nature of what we do. Where in healthcare, we can deal with a lot of people's sensitive topics. So we want to protect them and give them a little bit of anonymity and dignity so that way they feel comfortable giving us as much and accurate information as possible so that way we can treat them properly. Because if you're trying to treat something, and if you're, let's say you're in an you're in an OBGYN visit and your patient isn't telling you that they've been sexually active with 40 people, 20 people, 10 people since the last time you saw them 6 months ago, there could be things that the purpose of the visit may be led to a lifestyle modification. Or it may be something that, hey, maybe we've got a condition that we're rather, sensitive about, plaque
Mhm.
psoriasis. So it doesn't even have to go to like the STDs or anything like that, but it can be something as sensitive as that, or even something where I have a job that requires me to be extremely healthy, and I don't want a lot of people to know about it. So you would have the situation where you want to make sure that the patient is protected.
So you would agree then, when patients trust their healthcare provider, they're more likely to share vital information, and
Absolutely,
ultimately it
absolutely,
leads to better communication at the end of the day,
yeah.
because the trust is there, right?
I mean, shoot, everybody in this chat right now, I know that they deal with patients on a regular basis. The patients trust you and they don't tell you everything. What do you think happens if they don't trust you? You kidding me? Like
Yeah, yeah,
it becomes a wild scenario. You have no idea how many different hands are in that cookie jar, working with that patient. So it becomes very, very complex and risky.
agreed. So obviously moving on to consent in healthcare, can you explain to the audience the concept of consent? And I did list out three different types of consent. Maybe you can elaborate on
Yeah.
the three, and if you have
Yeah.
anything else
So
you want to add.
implied consent, it would be something that, let's say, um, the patient came in, the purpose of the visit is for a certain procedure or something along those lines. So obviously, hey, let's say the patient's coming in for an MRI. Well, I'm going to need you to change into this or lay down here, and I want you to stay put for, certain things are going to be asked of them that would normally, especially here in the US, could be considered like, hey, you're violating my privacy rights. Whole another bag of tricks, but
Sure.
in order to do the purpose of the visit, we have to do A, B, C, and D. So, if, for example, I need to go get my wisdom teeth taken out, well, I've got two options normally. I can either do this while I'm awake or do this while I'm asleep. But either way, I promise you, some kind of anesthetic is going to be involved. So, do you want that needle? Do you want that gas mask? It's implied that you're going to want that anesthetic so that
Sure.
way they can do the procedure. So, different things like that. That's the implied consent. And the example you have here is a great one for that. Informed consent, this is normally where we start asking for paperwork to be signed. So informed consent, you're sitting here and saying, hey, right now you're seeing this a lot with medications because there's a lot of contraindications. There can
Yes.
be certain types of classifications of drugs that you need to inform the patient of, hey, this may be a habit forming medication. I see that a lot in mental health. You see it a lot in pain management, where, hey, this drug could be habit forming. So I need to inform you of this. I need to also inform you of, hey, if you're going to take this medication, do not. And I am telling you point blank, and I'm documenting that I'm telling you that you should not take these medications or take these drugs because it will mess with things. One of the popular ones is, alcohol plus any types of mood adjusters.
On the
You don't want
telehealth
to be
end of
doing.
things, do you deal with a lot of the informed consent realm, or
So
is it or
Well, so that's interesting that you say that. So if we go
yeah.
on the telehealth side of things, the implied consent would be wherever the patient initiates the visit, anything that's happening on their neck
Mhm.
of the woods.
Mhm.
So where if they decide to take this visit at their office, at their house, at their church, at the park, they've implied consent for everybody in the area to know what's going on for this visit. The informed consent would be, hey, you're at your house, I'm at my office. I'm going to bring in another provider to take a look at this with me here. Or the informed consent would be something along the lines of, let's say we're doing a ketamine treatment.
Mhm.
Well, you're doing the ketamine from your house. We're having somebody babysit you to make sure you don't have a bad trip, make sure that if there's any issues, we can call 911 and get you emergency responders right away. So there would be that level of consent along that way. The written consent, that's where
I'm a
really you go ahead.
I was gonna say it's interesting because that's kind of where I wanted to go with this, where you were saying they can just take the call from wherever they're at.
Absolutely.
That's kind of the beauty behind the telehealth side of things. But from the compliance standpoint of that, I'm just assuming that you probably have them sign some sort of whether it's a privacy agreement or something that states that, hey, if you're taking this call from the Starbucks down the road, you know,
Well,
in those
they don't
type.
have to sign anything for that because again,
Uh-huh.
they're allowing consent on their end
Sure.
wherever they go. Now,
Okay.
I would need to get written consent with the patient if I was to take it at a park or a church or in my car because I'm not in my office.
Understood.
I would need that. Hey, I need that consent. I need that consent if we're doing telehealth and I'm going to record the session.
Okay.
I need that consent if we're going to be if we're going to be taking pictures in the office and they may pop up on marketing material. That's one that can, especially for certain types of specialties, you can get into quite a bit of trouble for that if you don't have consent there. Um, we've seen quite a few. Most people don't do it for pain management, mental health, and infectious disease. But I've even seen some physical therapy clinics get into trouble for not having the consent of the patient as pictures are being taken and then being posted on their
Mm.
social media or on their website. Um, but this is all relatively common sense. Where things get more complex is, and where the written consent, there's a lot of arguments are, is who can I talk to if the patient is incapacitated or if they're sick and and unable to speak to the office, but
Sure.
either a script needs to be refilled or they need to set an appointment or they need a copy of the medical records. This is where that written consent really, really, really is important. And there are certain documents that exist outside of the normal healthcare industry that can help us, but we need to be aware of it can also hurt the patient. Things like power of attorney, things like uh God, why am I blanking on it? Um, Power of attorney. I was just dealing with this as a patient, and they're basically signing away their rights. But that's the power of
Right.
attorney. So we'll just go with that one for now. I'll
No,
remember it
that's
in 20
fine.
minutes, and I'll scream it out, like Yahtzee or something. So what we want to do is make sure that, especially if we're dealing with a geriatric population or a population that can develop mental health conditions, we really want to make sure that that protocol is nice and tight,
Mhm.
because you can't talk to anybody that's not on that list.
I have
So if you have, go ahead.
I was gonna say, obviously, Spanish speaking patients as well, where maybe they have an interpreter
Well,
or
the interpreter would be under that.
a family member interpreting consent.
So
Um,
if the interpreter is someone from their family, there's it's implied consent because they're bringing them,
gotcha.
right? So
Yep.
if the patient is bringing whatever tool it is to conduct the visit, you don't need to get consent as a practice because they're the ones doing it. Now, if we're bringing the interpreter for you, which according to federal regs, we have to at least have available the top three secondary languages for your area, which can get rather difficult depending on where you are in the US. Um, it becomes a situation where you got to go and say, hey, all right, I need your signature saying that you'll allow this interpreter
Hmm.
to be sitting in on the appointment,
Hmm.
and then moving forward. Now, me as a practice, if I am bringing in that interpreter, I need to get a business associate agreement,
Of course.
because they're having access to PHI just by virtue of translating.
Sure.
They may not be documenting anything, they may not be recording anything, but they're seeing who the
Doesn't
patient
matter.
is. They're privy to all the conversations that we have. So it becomes a whole hullabaloo. Written consent also, this I see this a lot here in Northeast Florida, or in Florida in general, with the high geriatric population, where who has access to that person's medical record? They may have a kid that's in Ohio. They may have another kid in California, but they only talk to the kid that's in Florida because the Florida one is the one taking care of them. But if the Florida one is incapacitated and one of the other siblings comes down, can you even talk to them? Can you even say that, yes, I know that that patient does exist to me here at this practice? No, you can't. If they're not on the list, you can't even acknowledge the existence of the patient, much less give anything out.
Right.
You know what I mean? Like, it becomes, so it's one of those things where we really, especially for the geriatric population, especially for pain management, especially for neurology, where you're dealing with dementia and Alzheimer's and even Parkinson's, where it's hard for them to communicate. Anything where it's hard for the patient to communicate, you want to make sure that they have tight written consent forms, so that that way you can help the patient when they need it. Because it's not that we want to be a pain in the butt about it. It's that we have to by law, because
Have
the
to.
one
Yeah.
time we don't, when we're trying to do what we think is best for the patient, is exactly the time that we end up in a lawsuit 60 days later. So like, for example, you have all kinds of different consents and different scenarios that break the rule. One of the old ones that we always used to do as a trick question, if you will, is, let's say I'm the patient of the practice, all right? And I have a daughter. My insurance, we're both patients. My daughter goes in and she's pregnant. Do I even have access to her health information now? Even though she may be a minor,
Hmm.
she may be 15, she may be 16, she may be 17. The answer to that is, honestly, she is an emancipated adult for the period of time that she is pregnant. And then once that
It's
baby is
interesting.
born, then she reverts back to being a minor. But anything that happens while she's pregnant, I I am not privy to that information unless she explicitly says it, that yes, you can talk to me. It's an entirely, and again, it's a scenario that's extremely complex, but it happens more often than you think,
Yeah, I didn't know that. So she would have to provide you with some sort of at least informed consent, or I would
She
assume
would
maybe
have to
maybe the
document.
practice provides written consent for that, or both.
Well, so
Sort
there's
of
a couple
depends.
ways around it. As long as the patient's cool with it, and I'm talking about the patient as in the minor, then the
Sure,
minor can give verbal or written consent to speak to any adult or any
sure.
guardian. And then you move back and forth. In our mental health practice, we recently had a problem where a lady had power of attorney, or a lady's daughter had a power of attorney, and she was concerned about it, but then once we got her stabilized, she was far more sane with her um her diagnosis, and she was able to really live like a normal person. So then she was like, "Hey, I want to get rid of this." And I'm like, "Well, if you have the mental capacity to understand that we have a power of attorney, then you have the mental capacity to get rid of that power of attorney. You just need a lawyer to say that, hey, we're getting rid of that, and
Hmm.
I need a copy of it."
Hmm.
You know, if you're a minor, and let's say that, again, we had this recently in our mental health practice, the patient has opposition defiant disorder and is depressed and anxious and going through all kinds of nonsense, but one of the parents is the cause. So the patient was like, "Hey, I'm cool with you talking to this parent, but don't talk to that parent. I don't want them to know." This becomes a situation of, all right, well, what do we do? So
Right.
in those kinds of scenarios where we're clearly the provider and the patient, and then the patient's parent that's there is, we're all in consensus that, hey, the other party is the issue, then we won't release information to that party, even though it's a parent, just for the safety of the patient.
No, that
It
makes
becomes
sense.
a
It can.
whole
It can.
it gets
I'm actually
it can get
interested.
super complex super fast.
Anybody that's anybody in the audience, feel free to share if you have any stories of situations like this, and where consent's involved and there's multiple parties. Or if you
I mean,
guys are
I've
interested, I could put you on the spot. I could allow you to talk as well if it's a story worth sharing.
Susan's got 50 of those, 60
I
of
was
those. I
hoping
mean,
for Susan to jump in.
I've even seen it so
Susan, I know
much
you
that
got one.
I've even seen it where, like, a situation where a patient no longer lives at the address, but the practice sends a bill to that address.
Oh man.
It just so happened a family member of the patient lived there. The patient got mad at the practice. Active patient got mad at the practice because the practice sent a bill to the address that they have on file. And he's like, "What are you doing? I'm going to get a lawyer." And we're like,
Well, let me
"If
ask you
we
this:
ask you, any of your information has changed
It's
every time you
change
come into
each
the
visit,
practice."
right?
And
Right.
I mean, I don't know a medical practice that doesn't do this now. "Hey, welcome. How are you? Has any of your information changed?
Right. That's
Your health
yeah.
insurance, your address, your phone number, your insurance, any of it changed?" The answer default 100% of the time. People will say no,
No.
no, no, no. Any medication changes? No. And then they go back and see the provider, and then three things pop up magically. And you're just like, what do we what do, we already asked you this twice.
Right.
How is this possible? So it just becomes a whole thing. So you just got to do the best that you can, honestly, and just have it documented. So cool. What's
No,
next?
good stuff, Jose. And talk a little bit about permitted uses and disclosures,
Perfect. So
and its
one of the
categories.
ones, yeah, yeah. So I mean, obviously, to the patient, we as a practice can disclose almost whatever they're asking for. And I say almost because, again, in certain specialties, we have the ability to censor certain documents in the medical record when giving them out to the patient if we think that it may be harmful to the patient. So you see this a lot in mental health with counselors' notes.
Mhm.
Hey, the patient might be a little bit suicidal, or hey, the patient's claiming that they're not suicidal, but according to the tests I've run and my medical opinion, I think that this patient may be suicidal. Like different things like that. You have discretion on what information you give out. Treatment payment operations, TPO for short. You probably hear that one a lot if you're in the healthcare industry in admin.
Yeah.
This is obviously you're going to, you as the covered entity are going to be giving information out to the insurance company, to the pharmacy that the patient gave you to send medications to, to any of your referral partners. If it's an imaging company, a lab company, a specialist, a primary care, like, so for that kind of thing, you're going to be, you have to pass the patient health information across just to confirm the same patient, and then confer upon medical decision making. So another opportunity, agree or object. This is where, let's say, they are looking to get a second opinion. Then obviously, again, they're going to be released. They're going to be asking for disclosure of the information to the patient, and then going elsewhere with it. When it comes to the public interest and benefit, I hate this one, honestly. And I hate
How
this one
come?
because it's we see this a lot in athletics,
Mhm.
where they release far more information to the media and the population at large. It's almost as if the second you become a professional athlete, a politician, none of your rights as a patient exist anymore. So, for example, Secretary of State was just in a hospital, didn't let anybody know. Everybody thought it
Saw
was
it.
vanity medicine until it came out that it was for prostate cancer. Like, you hear it all the time for athletes. If, oh, hey, by the way, they broke their knee, or oh, hey, they have some off the field issues. What are the off the field issues? Well, one guy blew up his head with a firework, but then there's another guy that has mental health issues. Why do we as the media, why do we as the public, there should be no public interest for this kind of crap. You either show up to
Right.
work or you don't show up to work, but you should have some level of privacy. That's one of the reasons why I don't really like this one. I feel that people are not treated the same. You wouldn't care if well, we're in Northeast Florida. You wouldn't care if Trevor Lawrence was just walking around, but
Well, that's
he's
kind of
Trevor
the example
Lawrence.
I'm thinking
But
of.
you know what I mean? Like, if
He
he
got
wasn't a professional athlete, you
right.
wouldn't know who he was. And some people who don't
Sure.
know football just think he's Sunshine from
Well,
from Remember the
I
Titans.
was just
You know
thinking
what I mean? Like,
of the example where everybody thought that he had like a tore something in his ACL or MCL and ended up being some sort of high ankle sprain, and that he was going to be out multiple weeks, and then he miraculously just came in and played the week after that.
I mean, the amount of information that athletic corporations and politics give out to the public at large in regards to where, when, and
Right.
who are treating the patient is absolutely wild.
It is that to
You'll be
me
like, oh,
was pretty interesting
what
because,
was
like
it?
I said, they made it
Biden
seem
about
like it was terrible. He's going to be out for multiple weeks, and all of a sudden, oh, he's playing next week. It's like
I mean, what happened? It was like 7 months ago, I want to say. Biden was going under for a procedure that was relatively routine. They wouldn't tell us exactly what it was, but they told us he was at Walter Reed. They told us
yeah,
when he was there. They told us how long he was expected to be incapacitated because they swore Kamala Harris in for that period of time. You know what I mean? Like, they give us so much information. It doesn't matter at all.
right.
We don't need it. So I really don't like that one. Um, one of the other ones is also a subpoena, obviously. If you get a court subpoena, you got to give the information. How, what, and how much, that's the answer to that one is all depends
Hmm.
on what it is they're looking for. Anytime I'm dealing with a lawyer, I only give them exactly what they're looking for. I do not give them a fishing expedition. I do not give them a ton of information. It's just a because you don't know what they're trying to do. Your patient is
Sure.
your patient. Are they trying to help your patient? Are they trying to hurt your patient? It's lawyers are trying to make money. So I don't know what to say.
Good point. No, that's a good point.
But cool. Let's continue.
Yeah. So, well, this is pretty common sense as well, but
Yeah, we just went
um,
over that one. And then of course the civil and criminal penalties, that's to the government, but then there's the liability that the patients can sue as well. And that one's rough. So you can
have
see
you ever
that one.
experienced that, Jose, or know somebody
In
that
our
has experienced
practice,
that?
in our mental health practice, we have not. I hope that we never do. We have, however, experienced it with some of our consulting clients where perhaps there was information given under a subpoena that was outside of what the normal subpoena was asking for. So the practice ended up being liable for assisting the patient's opposition's attorney with information that damaged them. I
Okay.
mean, it can get super, super, super complex. So I would always say if the subpoena comes in, take a look at what's going on. Don't just follow what the subpoena says. Ask questions so that way you can really do what's best for the practice and what's best for the patient. And that's the biggest problem with the consent situation is that it's a seesaw. I've got to protect the practice as much as possible, but I have to have that patient health information accessible so that way I can help the patient get what they want done. It's a very, it can be a very difficult balancing act. 9 times out of 10, it's simple, but
Agreed.
sometimes it's not, and that the times that it's not is when it's beneficial to have either in-house counsel or a consultant that you can go to and be like, hey, I got this situation. And there's even times when we'll kick around um the hornet's nest with an attorney and be like, hey, what do you think of this? Just because we want to make sure that everything is proper. Oh, we brought up the no-no list.
Yeah,
Oh,
this
this
is
one.
I've and again for those that are joining, I don't know, Susan, I don't know if you're on last week's webinar, but we've brought this up, shed some light on it a couple of times. This is the Health and Human Services Department breach portal. And last week we were talking about business associate, obviously related events. And when I went and looked at the updated version this morning, I saw that at the top there it says type of breach, unauthorized access and disclosure, and it says paper
Now,
films. So
I Oh, so you know what that one was? I
yeah,
dollars to donuts. If it's paper and films and the business associate was present, somebody left some records out that they weren't supposed to leave out.
exactly. So
Somebody did a no-no. And you will always know the no-no as well as and it's always providers of a certain age that still have paper records that leave it in a public place because it's convenient for them to just grab and go to the next patient or sign the form and then leave it there for whoever needs it so they can take the form and move on. But they're all like stacked up nicely in a line.
mm,
Like this one, oh,
it's
this one is probably one of the most avoidable
I was
ones,
gonna say
honestly.
very very preventable, but
Very, very, very preventable. The only time where I see situations like this where it's not preventable, but this is hey, we're acting proactively is when there's like, for example, you have a provider that's running around from location to location or nursing home to office to the hospital, but they have records on them and they get into a
right.
car accident.
See,
You know what I mean? Like,
I was trying to decipher this one as well. This one says other, which is interesting, but again, another unauthorized access disclosure, business
so that one could
associate
be,
present.
I mean, so that one could be anything from like, hey, they have a server farm and something happened with the server farm.
Yeah,
You know, that one could be an IT company that took a laptop, gave it to somebody else, and they didn't wipe everything clean. Like there's a couple different ways that that could happen when it's that large. I mean, I mean, shoot, you could even have a billing company fire an employee, and that employee still has access to the patient records for a period of time, and they do something foolish. Like
right.
that one's one that's it's not uncommon, but it's doesn't happen frequently. So it's one of those things where if you separate yourself as an organization from an individual, before they walk out that door, you want to make sure that they have no access to any patient health information. So
100%. 100%.
I
But
mean,
going back to this, just Jose, briefly, just what kind of solutions can we expect? Obviously, um,
so
when it
it's
comes
all
down
about
to it,
risk, right? It's all
right?
when it comes to compliance, it's all about risk. You need to find out what are the most likely scenarios and things you got to deal with, and then have documentation. So if you're in cardiology, if you're in mental health, if you're in neurology, you want to have a situation, you definitely want to have something where it's like, hey, who do we talk to as next of kin? Who can we speak to about all of your issues? So that way, if the patient's incapacitated or the patient loses their bearing on reality, this happens a lot with paranoid schizophrenics. This happens
Mm,
not so frequently with bipolar individuals, but it can happen. You really want to make sure that, hey, who can we talk to? Who can we talk to about this stuff? I've even seen certain consent forms where it's boxes and they just check all that apply. You can talk to my wife about anything with payment, anything with my insurance, anything with my medication, but not about my diagnoses. You know what I mean? Like,
yeah.
so you can kind of pick and choose how you want to set it up, but the easiest way to do it is on the initial patient paperwork, because patients in the US are know that this is going to happen. Anytime they go to a new provider, they know they have a literal stack of half a tree of paperwork they got to fill out.
Yep.
You may be one of those people that, hey, I only come in for a freaking Z-Pack twice a year because of seasonal allergies. Tough.
That's too
I need
bad.
you
You
to
gotta,
fill all this
you
paperwork
gotta
out, boo
put
boo.
your
All this
initials on
paperwork
this.
out, boo boo.
Right.
Like it's man, I only
Well, it's
come to
like you
this
said earlier
pediatrician.
about the address stuff, it's your address.
Yeah, man.
They're still gonna
And
sign
then
it and forget or just not
oh,
do it.
absolutely. I mean,
But
and then one of the other things too is anytime you change that form, you want to make sure that you push that out to all of your current patients, because they may have version 1.0 from 1995 when we opened the practice, but now we're in 2023.
right,
The whole
right,
thing could be different. You know what I mean? So it's something to where it's good every couple of years to make all patients re-sign that consent form. If you're doing something where you have 1099ers coming in and offering subspecialty services, you may want to do that separately. So that way you have one for the practice, one for that. So it's a situation like if I'm a primary care and I bring PT in, that PT practice is just renting my space. They're a
right,
separate entity.
right.
They need a consent form for that, if they're going to be working with that PT, so different scenarios like that. So you really just want to figure out where your vulnerabilities are. And if you have any questions about that, someone like myself can definitely come in and poke some holes around and see where your vulnerabilities are. It's fun for me. So I guess it's not so fun for some people, but I try to make it fun for everybody, like, hey, I found these problems, but hey, I'm gonna give you the solutions for these problems. I'm not just gonna be like, have fun, here's the list, go play in traffic with it. No, I wanna I wanna help you out with it. It doesn't do anybody any good to give you the problem, but not help you out with the solution that fits for the practice. So
I would add too, as far as obviously the importance of protecting patient privacy and permitted uses and disclosure, consent to healthcare, all that stuff, training, education on HIPAA privacy and HIPAA security. That is something that we offer here at Epi Compliance, and I think many of you that are in here have probably taken these courses through us. Um, but
you even have
just
a defaulted consent form for all your clients on there.
yeah, there
Uh,
is,
the,
that is,
so
yeah, uh,
So if you're
obviously,
going to go and if it helps too, if you're a practice that's like, hey, I want to create our own, even though we have a company like Epi Compliance, take a look at the format that they have, recreate it, modify what you want to modify, and then make sure that everybody knows what's going on. But
yep.
it's always useful to have a roadmap when you're going to be doing your own thing to make sure that everything is covered.
And certainly that's certainly something that we provide, our Epi Compliance Pro package, which again I think many of you in here are users of, that provides you with policies, procedures, templates that you can use for these things, to just make the overall duty of being a compliance officer easier, right? There's already enough that you have to do managing a practice, etc. When it comes down to the compliance, Jose, I think you would agree with me that compliance is not It's not fun, but it's one of those costs of doing business, and it's one of those boxes that you simply have to check off as a practice. You need to have these things in place. Epic Compliance is here to help.
I would say that compliance isn't necessarily something that most people find fun,
Okay,
but
Jose finds it fun.
those that do find it fun are the ones that you want to delegate more tasks to. You know,
Absolutely,
it's
absolutely.
because they'll do the job properly. You know, these are generally very structured individuals that like
I was
things
gonna
black and
say
white.
yes, yes.
You want someone that can be rather anal and detail oriented as well, because it's not just having the policies in place, but making sure that everyone's aware of it and following it. And that can be the part that can be grating, because then you feel like you're parenting at work, which is not something you always want to do, like, but you got to have the personality for that kind of thing. So,
Have the personality, and obviously we have the platform, the tool to make their lives easier. Like I said, we provide all the policies, procedures in one place, all the training, all the tasking, business associate agreements, etc. um, so again, if there's anything that we can help you guys out with, please let Jose or myself know. Everybody's going to obviously receive correspondence from us after this presentation. If you're unsure of your needs, but you need to speak to one of us, there'll be a link where you can schedule a free consultation. We'll be happy to help you. But other than that, that concludes today's webinar. I wanted to open up just for a quick FAQ, or questions and answers. I'm sorry. If you guys have any questions, please feel free to put it in chat, and Jose and I will be able to answer those. Hey, Susan, thanks for participating today. Hope to see you on the next one. We'll be doing these every Tuesday.
yep.
Same time, 1:35 p.m. Eastern Standard. We say to 1:55, but we always go over. But it's okay. You guys are still here, so that means our engagement's good.
Stay out of trouble, Susan.
Listen, it's hard to talk on these subjects for 20 minutes, but hey,
I mean, we could do
we
it. It would be
could, but
dry as hell and
uh,
nobody would want to watch. But I mean, hopefully we keep it entertaining for everybody.
yes, that's the goal. We want to provide value to you guys, and that's why we're doing these webinars. And I mentioned this too. If you guys have any topics that you'd like us to go over, any scenarios, anything compliance related, just let us know. We can certainly make a webinar out of it and
Yeah.
discuss.
Yeah, we've got a few lined up. Ray, you want to tell them what the next
Yeah,
ones are?
it looks like nobody's got questions today. That's okay. I appreciate everybody joining in. Appreciate your time. Next week's topic, we are going to stick to HIPAA security. We're going to be talking about the essential guidelines for contingency planning. So that'll be next week's topic. Hope to see you guys there. Jose, I don't know if you want to add to that.
Yeah, there's more and less to it than you would think, all at the same time. So it's funny how that one kind of worked out as a topic. So I imagine that, some people will be very happy to hear that you can multitask with it, and some people will
Sure.
be unhappy to hear what the federal government requires. But we'll give you
That's what
the,
I'm going to
the
try
tip
to
and trick around it.
that's what
Huh?
I'm gonna try to list out in terms of what they require and the workarounds,
I
the
mean,
Jose workarounds.
I mean,
I love it.
it's literally just I'm gonna go ahead and give the bag away. By law, you have to have a contingency plan for every scenario.
Scenario, yeah, yep.
That's wild. So I got that means I gotta figure out hurricane and alien invasion. Awesome. What am I supposed to do with an alien? You know what I mean? Like, what am I
Earthquakes
supposed to
in
do with that?
Florida.
Or what are we gonna do with a volcano? We're in Florida. What? Like it's wild. The stuff that we snowstorm in Florida.
In other words, they're
I mean, I
very
know
vague. It's
Texas had
very
them
vague.
recently.
There,
Yeah, it's extremely vague yet specific what they want. But
right.
there's ways that we can go around it, and more importantly, there's ways that we can test it to show whether we're passing or failing. The federal government doesn't care if we're passing or failing; they just want to know that we're testing the plan. So, but we'll
Right.
go over that next week.
No, absolutely. And look forward to seeing everybody there that were on this webinar. And again, if you guys have any questions, concerns, please feel free to reach out to myself or Jose. We are certainly here to help. I hope you guys have a great rest of your day. Jose, appreciate you joining in yet
No problem.
again, and we'll see you on the next one.
Stay warm, stay dry, everybody.
Thanks,
Bye.
guys. Take care.